Hi, my name is John Howard. I'm a licensed acupuncturist, and today I'd like to talk to you about the ASP Permanent. This evening we were just going to take some pictures of what these ASP Permanent needles look like. We don't have one, and our new book is coming out today, so we thought, since we're taking pictures of the needles, why don't we show you exactly what they're used for. Here in the United States, these are not used. These are not FDA regulated, so you cannot use these. These were given to me by the company Sedatelec strictly for the purpose of taking a picture with them. In full disclosure, I do not receive any financial compensation from any of the companies that I do endorsements for or use any of their products, including Sedatelec. I was given these sample of the Permanent ASPs some time ago. So today I'd like to show you what these are and how they're used. In your country, if you're allowed to use these needles, these can be a really great thing. Anybody who uses the ASPs knows that sometimes you have one or two patients in your day-to-day practice who have one ASP that strictly does most of the work. So when it falls out, their pain comes back. This is where the ASP or the Permanent will come into play. One needle, it stays in permanent. It's called ASP, but it's really not. ASP stands for Agui, which is needle. It's semi-permanent. This is a true permanent needle. It stays in the body for indefinite. It's a medical device, and it's made out of titanium, a special type that's used for a combination of being in contact with tissues of the body. So let's take a look at exactly what this ASP Permanent looks like and show you how it's used. So as you can see, when you open it up, it comes in a pack of 8, which I have, I believe, 6 here because I've cut some out. And it gives you a little handout here, and it tells you a little bit about it and how to use it. And I was reading through this, and one of the things I found that was kind of interesting, it said do not use more than 15 of these needles on one patient. That's a lot of needles to use at any given time, especially that are permanent. They're almost similar to the ASP that's non-permanent. They're pretty close. But these are a little different because if you can see here, there's a metal spike that's right inside that plastic tube or the injector. That pushes the ASP Permanent, or just the Permanent, into the ear. So just like with the regular ASP needles that you can buy here in the United States, it's the same way you open them up. You take your thumb, you push. And since they're titanium, they don't have a magnet, they just have a little blue spot there. All the other needles that are not titanium, the gold and stainless here in the US, have a magnet. So what you're going to do is, if this is your patient's ear, you're going to do the same thing as you're inserting the ASP. You're going to find the point or the spot, you're going to properly clean it, and then what you're going to do is you're going to insert it. If this needle needs to come out for any reason, you can use a scalpel to take it out. And like I said, these are only supposed to be used by people who are properly trained in inserting these ASPs or any other type of medical device in the body that stays for a long period of time. And they consider that anything over 30 days. So this evening we're going to just take some pictures, but let me just show you how these work. So just to find a point anywhere, I just take this needle, I press. And as you can see, it goes in pretty far into the ear. So when I would draw this out, the needle is actually in there right now, and there is nothing now left over. Can you see that? And I'll put up one side by side so you get to see what they look like. The one in my left hand has an ASP in it, a Permanent, and the one in my right hand is the one I just injected into the ear. So if you look at the needle, with the area where I insert it, right in the inferior notch over by singular gyrus, you will see there's nothing sticking out. If that was a true ASP needle, gold or titanium or even a stainless, you'd see it sticking out. But now I have a needle embedded into my plastic ear, which I need to go fishing out after this video is over. And just for training purposes, let me just see if I can hold up to show you exactly what one of these needles looks like, and please bear with me. Here it is. I'm going to try to get this from the back end here. These are so tiny. So that is the ASP permanent needle that stays in place. Our book, Battlefield Acupuncture 3.0, will be coming out later today. So if you'd like to know more about the ASP permanent needle, the Battlefield Acupuncture protocol, or the ASP needles, look us up on battlefiedacupuncture.net. You'll find more information about our seminars and all the ASP needles. Thank you.